Welcome back to our health podcast. I'm your host, and today I am absolutely thrilled to be sitting down with Dr. Roberts to discuss a topic that seems incredibly familiar, yet it hides so many dangerous misconceptions. It's something many of us do every day without a second thought.
It's a pleasure to be here. And you are right. The topic we are diving into today is deceptive. It sounds simple, taking calcium, but it is actually riddled with hidden traps that can severely impact your health.
Exactly. Today, we are going to unravel a paradox. Why is it that so many people diligently take calcium supplements to protect their bones and joints, hoping to stay strong as they age, but in the end, the result they get isn't strong bones, but kidney stones and ureteral stones?
That is the million-dollar question. In my clinic, I frequently encounter patients who are completely bewildered when they hold their kidney ultrasound results in their hands. They look at me with wide eyes and say, "Doctor, I don't understand. I live a very healthy lifestyle. I exercise, I eat well, and I'm extremely diligent about taking my calcium and vitamin supplements every single day. How can I possibly be sick?"
It's heartbreaking, isn't it? They think they're doing everything right.
It is very distressing. I see this as an alarming reality. Over the last decade or so, information about osteoporosis and the risk of hip fractures in the elderly has become widely popularized. While awareness is good, it has had an unintended side effect. Calcium pills have inadvertently become a sort of protective amulet for many people.
A protective amulet. That's a very interesting way to put it.
Yes, many families buy it for their elderly parents out of love and filial piety. They think, "Mom and Dad are getting old, they need this." But they don't understand that if you take it the wrong way, that calcium pill doesn't go to the bones. Instead, it turns into bricks that build a wall of stones inside your body.
That is a terrifying image, turning a supplement into a brick in the kidney. I think we're operating on fear rather than medical knowledge. Dr. Roberts, do you think many people currently view calcium as just a harmless type of candy that anyone can use?
That is precisely the problem. The biggest mistake that I see is that people skip the most important step, the examination and testing. I've had older patients tell me that they drink it because they're terrified their bones will shatter like glass if they don't. They follow word-of-mouth advice. They follow advertisements targeting menopausal women, but they do not know if their kidneys are actually strong enough to handle and filter that amount of calcium load.
So we're worrying about the destination, strong bones, but forgetting about the engine inside, the kidneys that has to process all of this.
Correct. And when you overload the system or do it incorrectly, the kidneys are the first casualty. Let's talk about the habits involved. You mentioned seeing people drink calcium in very casual ways.
Oh, absolutely. I see it all the time. People treat it very casually. I know people who keep a bottle of calcium on their desk and just pop a pill whenever they remember. It could be morning, it could be night. Some people even dissolve effervescent calcium tablets into other drinks like orange juice or soda just because it's convenient or tastes better. They think, hey, vitamin C is good for me too, right? Why not mix them?
And that right there is a recipe for disaster. That combination is one of the most common and dangerous errors I encounter.
Really? Mixing calcium and vitamin C? I think a lot of listeners are going to be surprised by this. Can you elaborate on why that specific habit is so bad?
It comes down to basic chemistry within the body. Let's look at a specific case study to make this clear. I remember a patient, let's call her Miss Lan. She was a perfect example of this fear of aging.
Please tell us about Miss Lan. I think hearing a real-life story helps everyone visualize the danger much better.
Well, Miss Lon was terrified of getting old and frail. She had a friend who broke a hip, and after witnessing that, she decided she would do everything in her power to avoid it. So she went out and bought calcium supplements. But she didn't stop there. She read somewhere that vitamin C helps with immunity and anti-aging, so she bought high-dose vitamin C effervescent tablets as well.
That sounds like a very common shopping list for health-conscious people.
It is. But here is the fatal flaw in her routine. She didn't like the taste of the plain calcium pills, and she loved the fizzy taste of the vitamin C. So every day, she would drop her calcium tablet into a glass of dissolved vitamin C. She thought she was creating a super drink for her health.
I can see the logic she used, even if it was flawed. She thought she was doubling the benefits. What happened to her?
She ended up in my office in severe pain. When we looked at her history, she was shocked. She said, "Doctor, I take care of myself better than anyone I know." But here is the science. Calcium is not a candy that just melts away. It is a mineral that needs a specific pathway to be absorbed. It needs blood to transport it, and crucially, it needs the kidneys to filter it.
So it's a heavy logistical operation for the body.
Exactly. Now, when Miss Lon combined high doses of calcium with that concentrated vitamin C drink, she created a chemical environment in her body that is perfect for forming stones. Vitamin C, or ascorbic acid, when taken in excess, can convert into oxalate in the body.
Oxalate. I've heard of that. That's the substance found in some vegetables that causes stones, right?
Yes. Now imagine you have a high concentration of calcium meeting a high concentration of oxalate in the kidneys. They bind together instantly. Instead of the calcium going to the bones where it belongs, it binds with the oxalate to form calcium oxalate crystals. These are essentially tiny rocks.
So, by mixing them in that glass, she was essentially brewing a kidney stone potion every morning.
In a way, yes. And to make matters worse, she was drinking this concoction in the evening sometimes, or substituting it for water throughout the day. She wasn't drinking enough plain water to flush these crystals out. So today a little crystal forms, tomorrow another one sticks to it. Over months and years, these microscopic crystals fuse together to become a large, jagged stone.
That is terrifying because it happens so silently. You don't feel the first crystal forming.
You never feel the beginning. You only feel the end result when it's too late. Another huge mistake I see, similar to Miss Lon, is the timing and the fluid used. I have patients who swallow calcium with sweet tea, carbonated sodas, or even coffee.
I've seen that too, or people who take it right after dinner because they forgot to take it in the morning.
Taking calcium at night is a terrible idea for most people because your body is about to go into a state of rest. The kidneys slow down their filtration rate during sleep. If you dump a load of calcium into the system right before bed, it just sits there in the kidneys, settling like sediment in a pond.
That visual of sediment settling in a pond really drives the point home. It's not just about what you take, but when and how you take it.
Precisely. And we haven't even touched on the issue of stacking supplements yet. This is another area where well-meaning people destroy their health.
You mean taking multiple different types of supplements at once, like a cocktail of pills?
Yes. Let's talk about another case, a retired accountant named Miss Han. Her story perfectly illustrates the dangers of the more is better mentality.
I am very eager to hear about Miss Han. Accountants are usually very precise and careful people. I wonder how she fell into this trap.
Dr. Roberts. She was indeed very precise. She treated her health like a balance sheet. She thought if she invested heavily in supplements, she would get a high return on her health. Miss Han had retired, and she started feeling some mild back pain. She assumed, without any x-rays, that it was osteoporosis or arthritis, simply because of her age.
That is a very common assumption. We ache, so we assume we are falling apart.
Correct. So she became her own doctor. She went to the pharmacy and bought calcium. Then she heard vitamin D helps absorb calcium, so she bought that. Then she saw an ad for glucosamine for joints, so she added that to the pile. She was taking a handful of pills every day.
Wow, that is a heavy load for the body to process. Was she consulting anyone about this combination?
No one. She thought, these are just supplements. They're natural. They can't hurt. But here's the catch. Miss Han also had a specific dietary habit. She loved salty food. She ate dried fish, pickles, and used a lot of fish sauce. And, like many older people, she didn't feel thirsty often, so she drank very little water.
Oh no, so we have high calcium intake, high sodium intake from the salt, and low water intake. That sounds like a perfect storm.
It is the ultimate trifecta for kidney destruction. You see, sodium and calcium compete for transport in the kidneys. When you eat too much salt, your kidneys are forced to excrete more calcium into the urine. So, even though she was taking calcium pills, her body was dumping calcium into her urine because of the salt.
So she was wasting the calcium she paid for and simultaneously hurting her kidneys.
Worse than wasting it, because she wasn't drinking water, that calcium-rich urine became super concentrated. It couldn't flow out. It sat there. The calcium that was dumped into the urine crystallized.
And I assume she didn't realize this until the pain started.
She came to me looking very pale. She said she had back pain, but this was different. It wasn't a dull ache anymore. It was a sharp, stabbing pain that radiated from her back down to her lower abdomen. She was sweating, nauseous, and terrified.
That sounds like classic renal colic, kidney stone pain.
Exactly. When we did the ultrasound, she had a stone almost 1 centimeter in size. She was flabbergasted. She kept saying, "But I take calcium to protect my bones. How can I have stones?" She felt betrayed by her own efforts.
It is tragic. She was trying to build a fortress for her health, but she ended up locking herself in a prison of pain.
The saddest part is that she viewed these supplements as an investment for the future to avoid being a burden on her children. But her lack of knowledge about drug interactions and dosage turned that good intention into a medical emergency. She spent months in pain and had to undergo procedures that could have been completely avoided.
It really highlights a massive gap in our understanding. We think of the body as a bucket, just fill it up with good stuff, but it's not a bucket, is it?
No, it is not a bucket. It is a complex processing plant. If the input exceeds the processing capacity, the machine jams. In this case, the machine is your kidney.
Dr. Roberts, can you explain a bit more about the pain aspect? I think people underestimate how much a kidney stone hurts until they have one. You mentioned Miss Han was sweating and nauseous.
The pain of a kidney stone moving, especially when it gets stuck in the ureter, the tube connecting the kidney to the bladder, is often described as being worse than childbirth. It is excruciating. It's not just a bad back. It's a visceral, tearing pain that makes it impossible to stand, sit, or find any comfort.
Worse than childbirth. That is a comparison that will make every woman listening sit up and take notice. It is incredible that a tiny little stone, formed from something we think is healthy, like calcium, can cause that level of agony.
It really is. And it's not just the pain. A stone isn't just a rock blocking a pipe. It is a source of infection. When urine cannot flow because a stone is blocking it, the urine backs up into the kidney. This causes the kidney to swell, a condition we call hydronephrosis. Stagnant urine is a breeding ground for bacteria.
So you could end up with a severe kidney infection on top of the stone.
Yes, and if left untreated, it can lead to permanent kidney damage or even kidney failure. Mrs. Hine was lucky we caught it before her kidney function was permanently destroyed, but she had to learn a very hard lesson.
Dr. Roberts, we have talked about the mistakes. Mixing calcium with carbonated water or vitamin C, drinking it at night, not drinking enough water, eating too much salt. It seems like the line between a health protector and a silent killer is very thin.
It is extremely thin. It lies entirely in how you use it. We should not fear calcium. Calcium is essential, but we must fear ignorance. We must fear the autopilot mode where we just pop pills because an advertisement told us to.
I love that phrase. We must fear ignorance. It reminds me of the analogy of the body as a city.
Yes, think of your body as a bustling city. Calcium is a vital cargo that needs to be delivered to a construction site, your bones. But to get there, it needs a highway, your blood vessels, and it needs a traffic controller, vitamin D and other hormones.
And the kidneys?
The kidneys are the city's waste management and recycling center. If you flood the city with too many delivery trucks, too much calcium, and you don't have enough water to wash the streets, the traffic jams. The cargo gets dumped on the side of the road. That dumped cargo hardens and becomes the roadblocks we call kidney stones.
That makes it so easy to visualize. So Miss Lan and Miss Han essentially caused a massive traffic jam in their internal cities.
Exactly. And they fired the traffic controllers by not consulting a doctor. They tried to run the city themselves without understanding the map.
I've heard you mention the difference between Western and Eastern medicine perspectives on this. In the West, we look at the chemistry, calcium, oxalate.
How does the Eastern or holistic perspective view this issue?
That's a fascinating angle. In Western medicine, we look at the hardware, the tubes, the stones, the mineral density, but Eastern medicine looks at the qi or energy flow. They believe that the kidneys govern the bones.
The kidneys govern the bones. That sounds contradictory to what people think. People think calcium governs the bones.
Right. But in the holistic view, if your kidney energy, kidney qi, is weak, your bones will be weak, no matter how much calcium you eat. If your spleen and stomach, the digestive system, is weak, you cannot transform that calcium pill into usable nutrition. It just becomes dampness and phlegm, or in modern terms, metabolic waste and stones.
So, by overloading the system with supplements that the body cannot digest or process, we are actually weakening the kidney qi, which in turn makes the bones weaker.
Precisely. It becomes a vicious cycle. You take calcium to help the bones, but you damage the kidneys, which are the root of the bones. So you end up with both kidney stones and osteoporosis.
That is a profound realization. It explains why simply throwing supplements at a problem doesn't fix it if the underlying system is broken.
It brings us back to the core message. You cannot replace a healthy lifestyle and proper medical advice with a pill.
So, for the listeners who are sitting there right now, looking at their bottle of calcium and feeling a bit nervous, what is the first step? What should they do immediately? We need an action plan, Dr. Roberts. We have scared them enough with the stories of Miss Lan and Miss Han. Now let's give them the solution. What is the very first thing our listeners should do today?
The first step is simple. Stop. Stop the autopilot. Stop taking supplements just because you've been doing it for years or because a neighbor suggested it. Gather all your supplements, your calcium, your vitamins, your joint pills, and put them on the table.
Okay, perform an audit of what you are taking, and then?
Then look at your habits. Are you taking them with orange juice? Stop. Are you taking them at night? Stop. Are you drinking less than 2 liters of water a day? Fix that immediately. Water is the cheapest and most effective medicine for preventing kidney stones.
Hydration seems to be the recurring theme here.
It is non-negotiable. If you take calcium, you must increase your fluid intake to help the kidneys flush out any excess. But the most critical step, the one that Miss Lan and Miss Han skipped, is testing.
What kind of testing specifically? If I go to the doctor tomorrow, what should I ask for?
You need to ask for a few specific things. First, a bone density scan. Do you actually have osteoporosis, or is your bone density fine for your age? You might be treating a disease you don't even have.
That's a great point. Don't fix what isn't broken.
Second, check your kidney function. A simple blood test for creatinine and a urine test can tell us if your kidneys are filtering properly. And an ultrasound can show if you already have small stones forming or gravel in the kidneys.
If someone already has that gravel or small stones, should they stop calcium immediately?
Not necessarily stop, but they definitely need a doctor's supervision to adjust the dosage or change the type of calcium. Perhaps they need to switch to dietary calcium from food like milk, cheese, and leafy greens, which is much safer and easier for the body to process than synthetic pills.
So food is better than pills.
Almost always. The body recognizes food. It knows how to regulate calcium absorption from a piece of cheese much better than from a concentrated tablet.
That is very reassuring. It feels like we are returning to basics. Eat well, drink water, move your body.
Exactly. We need to shift our mindset. Don't look for a magic bullet in a bottle. Look at your body as a complete system. Be kind to your kidneys. They work 24/7 to keep your blood clean. Don't reward their hard work by throwing bricks at them.
Don't throw bricks at your kidneys. I think that is the quote of the day. Dr. Roberts, this has been an incredibly eye-opening conversation. We started with the fear of broken bones, but we ended up realizing that protecting our health requires wisdom, not just supplements.
It has been my privilege. I hope that Miss Lan and Miss Han's stories serve as a constructive warning. Calcium is good, but only when used with knowledge.
Thank you so much, Dr. Roberts. And to our listeners, please take a moment today to review your habits. Share this information with your parents, your grandparents, anyone who might be unknowingly hurting themselves in the quest for health. Prevention is always better than cure.
Absolutely. Stay healthy, stay hydrated, and always listen to your body.
Thank you for tuning in. We will see you in the next episode with more vital health information. Goodbye for now.